So association of interim PET response with outcomes in all aggressive lymphomas have been interest of investigation for some time now. In diffuse large B-cell lymphoma, newly diagnosed DLBCL, there have been studies of heterogeneous populations that describe association of PET2 response with outcomes, and the results have been conflicting, and the regimens that the patients were treated with were also heterogeneous. So we decided to examine association of PET2 response and outcomes in two independent cohort of R2 CHOP based regimens. So our discovery cohort was consisted of patients with treatment naive DLBCL who were treated with R-CHOP plus lenalidomide, and our validation cohort consisted of patients with treatment naive DLBCL who were treated with R-CHOP, which is a standard of care. Now these two regimens have been shown to be non-inferior and quite similar in outcomes in recently published randomized phase 3 trials. We saw that in both cohorts, patients who had complete response after 2 cycles of treatment, that is PET2 response, patients who have complete response on PET2 had significantly improved progression-free survival and overall survival. And this difference was even more pronounced in patients who had high-risk disease, so IPI 3 to 4. By IPI, I mean International Prognostic Index for DLBCL prognostication. So patients who had a high-risk IPI of 3 to 4, in that group there was even more pronounced difference in progression-free survival between patients who had complete response with PET2 versus patients who were in incomplete response. We also noted that patients who had incomplete response in PET2 also were more likely to have residual disease at the end of the treatment, as well as primary refractory disease or progressive disease at the end of the treatment. So these findings are important because they give a fairly robust evidence of efficacy or ability of PET2 response to predict early outcomes in DLBCL and select high-risk populations. So this should be investigated more now that we have newer modalities of examining response using PET scan.